Hello, I'm Philip van Overschelde. I'm an orthopedic surgeon working in Ghent in the hip and knee unit together with 3 colleagues. Today we'll talk about the use of artificial intelligence in orthopedic decision making. What is the Moveup index? And what is important that we are 4 surgeons, we have 6 admin staff, 6 nurses, 1 X-ray technician, but most importantly we have 2 data engineers, and we are looking for a 3rd one currently. Patient satisfaction after total knee arthroplasty is something very special because 1 in 5 worldwide is not satisfied with the outcome. And the main reason is that expectations are not met, which means it might have been a bad indication at the time of planning. Patients' expectations have risen over the years. When my father was doing knee replacement early 80s, when the pain was gone, everybody was happy. Nowadays, people, they want to participate in sports and even very active sports, as you can see on this video. So, what is the best treatment for my patient? Is it surgery or conservative? What is the best timing for surgery? What surgical approach should I use? What implant can I use? And is there an advantage in innovative techniques? We all know the most valuable resource is no longer oil, but it's data. We've been using Moveup since 2015-16. It's an app and home-based program. It gains control beyond the hospital doors. It gives daily personalized adapted care, and it's in collaboration with a multidisciplinary team. So it can be given anywhere and anytime, and it's the first reimbursed digital therapeutic solution in Belgium. As you can see in the slide, it's April 2022. So reimbursement of the solution in Belgium. Here you see the hip knee unit data collection that started in 2016. I give you a presentation of my patients. It's more than 2,700 patients of whom we have all the data available in order to get insights into the evolution and the pathway of a patient. The reporting we get from Moveup is based mainly on PROMs and PBOMs. Although when you get these reports, it's very difficult to discuss these reports with the patient, because before a patient understands what's on the report, it takes 5 to 10 minutes to understand. We have, next to the PROMs, we have the clinical milestones. Again, it's very difficult to use all these data in your daily practice because the patient does not know what it means. Since Q4 2021, we also use advanced reporting in our daily practice. Here you see the evolution of the activity of a patient post-operatively. It should be between the green and the red line. But what is more interesting, it's the activity distribution during the day. And you see the dark blue means higher intensity of activity, the less dark blue, the lighter blue means less activity. And you see that that patient is active during the day, different phases of the day. We can also extract the 2-minute walking test. So the patient does not need to do a 2-minute walking test, but we can extract these data just from the single wearable device. Also, the 6-minute walking test is extractable, and we can go even deeper, which means the intensity of a patient's walking, the peak 30-minute cadence, and also the longest walking distance a patient does in one single shot. Here you see, for example, that patient is an increase after surgery and he goes into the right direction. All these data are used into the reporting nowadays. So the advanced tools are able to see differences that for a long time were not visible. But how can we use all these data, which means knee-related PROMs, comorbidities, past medical history, psychometric tools, socioeconomic factors, functional data, PBOMs, how can we use this all together in a consultation of 10 minutes? If you want to discuss all these details with your patient, your consultation will last for more than 1 hour. So we developed the Moveup index. It's an aggregated score between 0 and 100, and it integrates all of the above. You should know that the knee is not a hip, and the importance is the percentage of gain, not the absolute value. If the score can be doubled, the satisfaction can be anticipated. How do we implement this in the hip-knee unit? We have a light version and a full version. The light version is prompt-based. It's a quick check of your patient and allows you to do a triage, and that typically the patient has filled out before he comes for his first intake. During that first intake, we also do a clinical examination. We do an anamnesis. We evaluate the imaging, which might be an X-ray or more advanced scan images. Then we decide what should be the treatment. So we have the triage function of the data tool, the Moveup Index Lite. We have our anamnesis, clinical exam, and the imaging. And then we'll decide what needs to be done. Is an intervention planned, which might be an infiltration or surgery? Then we will use the full version to really fine-tune our treatment. In order to fill out the full version, you need more time, you need the wearable data, and it's with these data that you will be able to predict the outcome of the patient. So in our daily practice, this Moveup Index tool is a decision tool. It will help you to decide whether to operate yes or no. It's also a follow-up tool. If a patient comes back after 6 weeks or 2 months after surgery, we know from the Moveup Index where the patient is in his journey currently. So we know we can guide the patient, and we can, most of the time, reassure the patient that everything is going as it should be. It's also a data tool because it allows us to evaluate new techniques, new implants, and it's an added value, for example, for robotic use in total knee replacement to be very critical if that's an advantage for our patients, yes or no. So prediction in orthopedics is relating the outcome to the preoperative assessment and also to the surgery. So we have data related to the pre-op situation, we have data that we collect during the surgery, and that we will correlate with the outcome. And by doing this, you will be able to introduce prediction in orthopedics, and we use the Moveup Index tool to do that. I give you some examples. This is a total knee arthroplasty patient. That's an overview of all the data that we collect for that patient. Again, if you want to discuss that with your patient in your outpatient clinic, it's way too difficult, it's way too long, and the patient will not understand it. That's the indication. You see the X-ray, you see the result, bilateral total knee replacement, and here you see the evolution of the activity and the pain scores over time. This is a 3-month period. Again, way too long to explain this all to your patient. Interesting for us to do deeper analysis, but not to be used in daily practice. Also this, it visualizes the prompts, how they evolve during a 3-month period from preoperatively to postoperatively. Again, way too difficult to explain this. So here comes the Moveup Index. For that patient, for example, it was 46 preoperatively, and during the 2-year period, it evolved to 91. So the score was doubled. That patient was really satisfied. When we look to the prompts, for example, the Oxford knee score, quality of life, and the forgotten joint score, you see preoperatively low values, and when you see at 2 years, that patient has quasi all maximum values for the different scores. So a satisfied patient. Here you see a different patient. That patient has a different starting point. Same images, X-ray, which shows a medial away, and a patellofemoral away, which is an indication for total knee replacement. Again, the evolution of activity and pain scores, the prompts, and we look to the Moveup Index. Preoperatively, 54 instead of 46. So 54 is not easily doubled. And you see it in the outcome. At 2 years, it's 79. So we didn't manage to double the score. When you look to the preoperative prompts, this was completely similar to the previous patient, but at 2 years, they are different. So we have less good outcomes regarding prompts. Also, the Moveup Index is a bit lower. The score was not doubled. The patient is happy, but is not as satisfied as the previous one. So the Moveup Index helps you to guide the patient and to set expectations for the patients. You see a third example. It's one of my patients that was operated a couple of years ago. So we did retrospectively calculate the Moveup Index. Again, the indication, mainly patellofemoral AA with some valgus, the activity levels, the PROMs. You see the pre-op value of the Moveup index is 63. You know, if the Moveup index can be maximum 100, this index cannot be doubled. And you see at the PROMs, preoperatively the PROMs were too high, and you see at 1 year we have a bad result. The index at 1 year is 31, which is not a doubling, but an elevation of the index. Same is true for total hip replacement. Here you see the indication, arthrosis on the osteoarthritis on the right hip, which is treated with the total hip replacement. Here you see the activity evolution after a total hip replacement. You will notice that this graph is completely different from a total knee replacement graph, which is important, of course. Evolution of the PROMs, and we look to the Moveup index. Preoperatively, he has a Moveup index of 36, and you see already after 6 weeks the index doubled. So that patient comes into your outpatient clinic after 6 weeks and is really fully satisfied. Although the rehabilitation is not fully set, that patient is already fully satisfied at 6 weeks, and the Moveup index tells you that. It evolves even further until 91. You see the pre-op PROM scores and the scores at 1 year, which are the maximum values reachable. So we have a PROMs. The issue with PROMs is that you have a plateau phase, which is not true for the Moveup index. Same here, total hip at 6 weeks. You see the pre-op index and the index at 6 weeks. You see it more than doubled. So that patient satisfied at 6 weeks. The issue we see now that we have difficulties in motivating our patient to deliver their data after 6 weeks for a hip replacement, which is normal. If you have a normal life again, you're not motivated to fill out questionnaires. We go even further now in 2022. We are able, based on the pre-op Moveup index, to predict the outcome of the patient. Not only if the patient will be satisfied, yes or no, but also when the patient will be able to stop his medication, quit his crutches, start driving a car, start driving a bicycle, and return to work. So these are very important milestones which we now, with an 80% confidence, we can predict for a particular patient. So my take-home message is data are key for a better and cheaper healthcare. Value-based healthcare is data-driven. Listening to your patients so the anamnesis remains key in making the diagnosis and planning a surgery. If you involve the Moveup virtual clinic team, you're able to collect a full Moveup index. And as said, shared decision-making, where you make your patient responsible for the decision taken, is very important nowadays. And the Moveup index allows you to do that in a very elegant way.